Chapter 34, International Health Informatics Efforts. Healthcare is one of the largest sectors of the economy in various parts of the world. Health spending plays a major role in economic policy. The healthcare industry is challenged by economic uncertainty to streamline costs, gain efficiencies, and become more innovative to improve and maintain population health. The use of information and communication technology for health is seen as key to realizing this aim. The shared goal is to use technology to effectively and efficiently improve the health of individuals, families, and communities. Making Healthcare Better for European Citizens, an action plan for a European e-health area, was designed to facilitate a more harmonious and complementary European approach to e-health. The action plan covered a range of functions, from electronic prescriptions to new information systems that would reduce medical errors. The plan identified actions required for widespread European adoption of e-health technologies, and it encouraged individual members to customize strategies based on individual needs. Part of the e-health action plan concerns collaboration between the European sector and the United States. The United States Department of Health and Human Services and the European sector signed a Memorandum of Understanding in 2010 to strengthen transatlantic cooperation in e-health. The main purpose was and is to enhance European health sciences by encouraging the implementation of information science in the health field. The objectives of the European Federation for Medical Informatics are to, number one, advance international cooperation and dissemination of information in medical informatics on a European basis. 2, promote high standards in the application of medical informatics. 3, promote research and development in medical informatics. 4, encourage high standards in education in medical informatics. And number 5, function as the autonomous European region. One of the 3 priorities of the Asia-Pacific Economic Cooperation Health Working Group is to strengthen health systems of economies that include health financing, human resources, and health information technologies that would contribute to inclusive and secure growth. The Asia-Pacific Association of Medical Informatics promotes telemedicine, bioinformatics, and public health informatics. Because of the large size of its countries, the low specialist to population ratio, the affordable cost of technology and telecommunication, and the high penetration rate of e-health for equitable distribution of health care services, telemedicine has become an important aspect of e-health within the Asia-Pacific region. APAMI plays a key role in advancing, developing, and promoting bioinformatics through the cooperation within its region. The e-health strategy and plan of action was focused around 4 strategic areas. Number 1, the policies on the use and implementation of technology for healthcare. 2, improvements in public health through innovative technology, tools, and techniques. 3, cooperation among countries toward development of a digital health agenda for the region. And number 4, the knowledge management, digital literacy, and education in technology. The following two goals to develop health informatics within the region and strengthen regional ties are: number one, strengthen the network of health informatic societies in Latin America and the Caribbean. Number two, define the main health informatics topics to promote and the best groups to engage in these initiatives. Africa remains one of the least economically developed areas of the world. The wealth of a nation depends on the health of its population, making healthcare an area of high priority with regard to economic development. The World Health Organization called for strengthened health information systems, public health surveillance systems, mobile devices at the point of care, electronic health records, and other applications that provide patient billing, patient scheduling, and the electronic transmission of prescriptions. The key challenges impeding the wide-scale implementation of electronic health solutions in Africa include the following. Number one, the digital divide, as demonstrated by the need for increased awareness of e-health among health professionals and patients. Number two, a cohesive policy environment that provides leadership and coordination with improved financial and human resources. And number three, a technical infrastructure and services within the health sector that monitor and evaluate the systems. The World Health Organization plays a key role in the development of global e-health, the vision of whose Department of Knowledge Management and Sharing is a world with better and more equitable health outcomes. The mission of WHO is to improve the understanding and application of knowledge management. The World Health Organization is responsible for developing, disseminating, and maintaining international classifications on health, collectively referred to as the WHO family of international classifications. This is designed to promote a consensual, meaningful, and useful framework that governments, healthcare providers, and consumers can use as a common language in health information systems. The classifications within the WHO family of international classifications are divided into three main categories. Number one, reference classifications, which are classifications of the basic parameters of health. Number two, derived classifications, and these are developed by modifying or rearranging reference classifications. And number three, related classifications. These are associated with the reference classification at the specific levels of structure only. The International Medical Informatics Association is connected with WHO as a non-governmental organization and with the International Federation of Health Information Management Associations. The IMIA is an important player in ensuring that information science and technology are integrated into all fields of healthcare. Its main goals are to, number one, promote informatics in healthcare and research in health, bio, and medical informatics. Advance and nurture international cooperation. Number three, stimulate research, development, and routine application. Move informatics from theory into practice in a full range of health delivery settings. Number five, further the dissemination and exchange of knowledge, information, and technology. Promote education and responsible behavior. Number seven, represent the medical and health informatics field with the World Health Organization and other international, professional, and governmental organizations. Goals of the International Medical Informatics Association, Nursing Informatics. Number one, to foster collaboration among nurses and other professionals who are interested in nursing informatics. Number 2, to explore the scope of nursing informatics and its implication for information handling activities associated with nursing care delivery, nursing administration, nursing research, nursing education, and various relationships with other healthcare information systems. Number 3, to support the development of nursing informatics in member countries and worldwide. Number 4, to provide appropriate informatic meetings, conferences, and post-conferences, and to provide opportunities to share knowledge and research that can facilitate the communication of development within the field. Number 5, to encourage the publication and dissemination of research and development materials in the field of nursing informatics. Number 6, to develop recommendations, guidelines, and courses related to nursing informatics. And number 7, to work with patients, families, and communities to implement informatics within the healthcare system. The International Council of Nurses, or ICN, is a federation of 136 national nurses associations that represent more than 16 million nurses worldwide. The aim of the ICN eHealth program is to transform nursing through the visionary application of information and communication technologies. Connecting Nurses provides a forum for nurses from around the world to share their ideas, advice, and innovations, and contribute to patient empowerment. The aim of Connecting Nurses is simply to bring nurses together. It provides an online platform for nurses from around the world to share ideas, advice, and innovations among themselves and with other healthcare professionals, patients, caregivers, and the general public. The International Organization for Standardization is the world's largest developer and publisher of international standards. The ISO is not affiliated with governments and does provide a link between the public and private sectors. It is uniquely able to establish a consensus on standards-related solutions for business and the broader needs of the society. Health Level 7 is an international community composed of healthcare subject matter experts and information scientists. Its goal is to create and sustain standards for the exchange, management, and integration of data that facilitate patient care and management, delivery, and evaluation of healthcare services. The American Medical Informatics Association is an American nonprofit organization that is dedicated to the development and application of biomedical and health informatics in the support of patient care, teaching, research, and healthcare administration. International Health Terminology Standards Development Organization is an international nonprofit organization. It owns and administers the right to systemized nomenclature of medicine clinical terms, also known as SNOMED CT, and its related terminology standards. A key problem in achieving global interoperability in eHealth is the lack of the meaning of terms interoperatively. Key barriers include issues relating to the terminology used in describing and documenting healthcare, such as cost and accessibility, gaps in exhaustiveness, and the lack of granularity. The lack of human resources with the necessary skills and competencies is a problem for the introduction and the use of eHealth in many parts of the world. The current shortages of skilled workers in the healthcare professions demand a human resource strategy and a long-term plan for the education and training of eHealth personnel that can ensure the quality of collected health data and its security and confidentiality, and to merge and maintain the systems and data in the future. If the e-health infrastructure or services are missing or deficient, e-health then becomes less effective. The digital divide is the result of a gap of information exchange between different demographics, and this remains a problem in terms of internet and especially broadband. Education programs will prove beneficial in the attempt to close the digital divide. Patient privacy is a core element of good healthcare practice, and legislation and regulation are key tools in providing privacy. Legal and regulatory e-health challenges vary from ambiguous legal frameworks to poor data management. A lack of regulations in the transfer of data leads to a number of challenges at the international level and may include misinformation, unethical use, concealed bias, covert self-dealing, fraudulent practices, and the evasion of legitimate regulation. Security is another area within e-health that presents many challenges. The increasing use of technology like biometric authentication for the identification is generating new challenges within security, safety, and privacy protection for the healthcare providers and consumers. Healthcare faces unprecedented challenges: an aging population, greater citizen engagement, unanticipated disasters, new advances in medicine, and increasing public expectations. All of these are within a context of a shrinking healthcare workforce with ongoing financial constraints.